tonight at the Black Physicians Forum 2018. We're here with Dr. Carl Hart, and we're welcoming you this evening.
I'm happy to be here. Thank you for having me.
Really glad that you're able to join us. We are here tonight to talk about modern-day drug addiction in relation to health and poverty in the African American community. Can you tell us a little bit about, your history with studying drug addiction and what you're working on now?
Yeah, I've been studying drug addiction about 30 years, actually about 25 years, and I started out studying drug addiction in part because of those issues that you just named, mainly because of my concern about drug addiction in the black community. But then over the course of this sort of 25-year career, I discovered that drug addiction is not really a big deal in the African American community. There are far more other important issues like employment or unemployment, education, racial discrimination. All of those things become far more important than drug addiction. And what drug addiction becomes is a distraction for people not to deal with the issues that I just told you about. So it took me damn near 20, 25 years to come to this position, but that's where I'm at now.
Wow, that's a very interesting perspective on it, especially with a lot of the recent changes that we've had in drug policies and this kind of movement towards a public health approach. And I think that might be in alignment with what you're talking about. How is that different than what we've seen in the media today and in our policies?
Well, I don't think we've had any changes in the past, 30 years in drug policy, really. I know under the Obama administration, people talk shit like we had some changes, but there was no real changes. It was more, there was a memo from Eric Holder, but that's not a policy change. It's just a sort of a priority sort of change, but it's not a policy change. And now we have this idiot who's the president, Donald Trump now, making a lot of noise about changing policy, but really he's not changing policy. He's just basically speaking to his base and changing the discourse, but it's not changing policy. So policy hasn't changed, and people have this misconception that it changed under Obama, or it's changing under Trump. It hasn't. We've had the same awful drug policy for about 30 years, and so there are some ways that we can change it. I got some ideas, but we just have to be clear, it hasn't changed. I mean, the first change that we should have when it comes to drugs, of course, is to legalize all drugs. I mean, because when we think about, what are the major concerns? We worry about people dying from drugs. I mean, people die from overdoses and so forth, but people don't, a drug like heroin, for example, it's really difficult to die from a heroin overdose alone.
So what are some of the real issues with the drug addiction that we should be concerned about, or ways we should move towards changing our current drug policy?
Well, think about drug policy. One of the things that drug policy is used for, when we think about black people, what we should be concerned about, drug policy is used as a great tool to subjugate people, particularly people on the margins. We can think about certain black communities. So if you want to make sure your drug policy is not being used to subjugate black people, change the policy. Thus, legalize drugs, like California has done with recreational marijuana, like Colorado has done, like Washington has done. And you look at the data from those places that had legal marijuana, they have dramatically decreased the number of arrests for black people, arrests for everyone. So
How do you address some of the concerns that people have about the harm that then happens to people, or when they actually go into drug addiction as opposed to substance use?
Yeah, people oftentimes misinterpret what's happening. So when you say the harms that people have, there's so many idiotic things that people think. You have to delineate which ones you're talking about. Now, I can go down the list of some of these idiotic things.
Can you give me two examples?
For example, sometimes people say, oh, marijuana is a gateway drug or something like that. It's not, and people confuse correlation with causation. For example, most of the people who have tried something like heroin, or a large percentage of them have smoked marijuana before doing heroin. But that doesn't mean that marijuana caused this, or marijuana is the reason for them to use heroin. Particularly when you look at most of the people who do marijuana never go on to do heroin or anything else. And you also know that Most of the people who do heroin also did milk before they did heroin, but we're not calling milk a gateway drug. So, I mean, there are a number of these sort of idiotic things that people think about drugs. People think about this whole issue of drug addiction or marijuana causing brain disease, that sort of thing. Again, there's no empirical evidence to suggest that, but people misinterpreting the evidence. And this is the biggest problem, people's misconceptions, not the drugs themselves. We can go down the line. We think about drugs that we have that are legal, alcohol, what have you. Of course, alcohol would be far more dangerous than most of these other drugs.
And weren't there some of these similar concerns about legalizing alcohol at the time before when we had
Right
prohibition?
on. But the point is that every society needs to have a psychoactive substance, a recreational drug, and we have ours. We have alcohol, growing now, cannabis, and so forth. So. People have to understand that first. I know I want something psychoactive when I want to relax and chill, and I don't want anybody to tell me I can't have what I want to have. I'm an adult. I pay my taxes, I pay my bills, I do all of these sorts of things, so I have that right. Now, given that that's the case, we in science have learned a lot about all of these drugs, how people can use them safer, how people can use them to enhance their functioning, their intimacy between partners, all of these sorts of things.
And is that what you feel that the campaign should be focused on?
First, we have to get out of the moralistic frame, and then that's how we have to deal with this. I'm sorry, you were saying.
So I was asking you, is that what you feel like the real education here is for us, how to help people if they're going to use substances, to use them safely and to use them appropriately?
Well, think about driving a car. Think about driving, there are 37,000 people who die every year on American highways from car accidents. So what do we do with that? So what we do is we just simply make sure the people who get behind the wheel know how to do it. And we have speed limits, we have seatbelt requirements, we have all of these sort of things that we do in order to make sure people do this activity as safely as possible. The same should be done with drugs.
Is there a best practice around drug use or drug policy that you would like to share with people?
There are some countries that do pretty well, but you have to understand that in the United States we have a big-ass military. And if you have a big military, you tell other countries what to do. And we tell other countries what to do with their drug policies. Countries that particularly who depend on American aid. There are a few countries who have said, screw you, America. You're screwing up your people, so we're not going that way. The Czech Republic is one. Portugal is one. Spain is another. You can look at examples around the globe where they do things better. They have more liberalized drug policies, and they're taking care of their people. But those countries that I named, the important thing that they have in common is that they are homogenous societies. That is, they are typically all white. And so therefore, they don't use their drug policy to subjugate a group, like our drug policy is being used to subjugate groups we don't like, people who look like you and I. And this is the thing that when people start talking about a public health approach, they need to understand that the racial discrimination that goes on with drugs or drug policy is far more harmful than the drugs themselves.
If there is one thing that you could get out to people about thinking about drugs differently, drug addiction differently, what would that be?
Just that. The harms associated with drugs are nowhere near the harms that are associated with drug policy enforcement, particularly to our community.
Right. Lastly, I know you have a book. Would you like to tell us about your book and encourage readers to read that?
Yeah, so I published a book in 2013 called High Price. I hope the readers know about my book. If you don't know about now, well, you may as well just wait for the next one to come out. It'll be coming out soon. Hopefully it'll be out early next year.
Okay, great. All right. Thank you so much, Dr. Hart.
Thank
we
you.
appreciate your time.
Thank you so much for having me. Thank you.
Well, hello, Dr. Tamu Noful.
Hello.
I'm so excited to see you here at the Black Physicians Forum tonight. We're talking about modern day drug addiction in relation to health and poverty in the African American community, and I know you probably have lots of opinions and perspective on this, so we're really glad that you're here to share it with us.
Thank you so very much. I'm happy to be here.
You have been doing so much work with mental health and African Americans. Would you like to tell us about some of the work that you're working on now?
Sure. Well, my work currently is in service to the Office of Health Equity in the California Department of Public Health. The trajectory, I think, of my work around this issue, around substance abuse, has spanned about 25 years. So I actually got involved in this work when I was in high school here in Sacramento.
Oh, that's wonderful.
As a volunteer to talk to other kids about substance abuse and skill building and that kind of thing. And it's kind of interesting to see how the research, I would say, has grown over the years to really understand the limits of that kind of work around addiction prevention, right? Mm-hmm. And so to be more in the space of what are the conditions that young people find themselves in, right? And so how can we impact those conditions to make sure that they have every opportunity to thrive?
And how is this public health approach kind of different than what we've seen to date?
Right. Well, I think, unfortunately, a lot of what we've seen has been, well, blaming the victim. Mm-hmm. It's been putting all of the onus on the individual around using drugs. And, of course, it's also been really targeting certain communities, particularly our communities, right? Black and brown communities.
Definitely.
So I think that that is primarily what we have seen and what I'm feeling like we're turning a corner on at this point, especially in California, is to look at this whole picture really differently.
And what are some of the new perspectives that how we are seeing this differently, where we're going with some of the different policies that we're enacting?
Exactly. Yeah. Well, once again, I think that there's more of this focus on the conditions. And so it's more of this focus on what is it that we need to do around poverty? What is it that we need to do around housing? What is it that we need to do around education so that people can be in a good position? You know, using drugs and particularly going down a road to addiction isn't something that just happens. It isn't, you know, kind of random. We can sort of see some of the lead-ups to that.
Some of those social determinants.
Some of these social determinants, exactly.
That are moving them in that direction.
Exactly. So they're not a surprise to us, right? We can act like they're a surprise to us, but they really aren't a surprise to us. If you have, you know, for example, a parent who is working 2 or 3 jobs in order to put food on the table, how is she going to supervise her kids?
Correct.
Right?
Yeah, her attention is elsewhere. She's physically elsewhere.
Exactly.
Not able to be on top of that as well.
Exactly. And so that's an unrealistic expectation that a parent is going to be able to supervise and understand what's going on during that time of exploration in their kid's life.
Right. They say those hours between 3 o'clock and 7 o'clock are the hours that most things happen for youth because it's unsupervised
and
time.
as more people have to spend longer commutes, right, in order to be able to put that food on the table, it's like we're just making things very difficult to be able to manage what, like I said, it's a process of exploration for young people to want to go out and try all kinds of things, right? Sex, drugs, rock and roll, all of that.
But that's not an unnatural
it's not
age
unnatural
or behavior for that
exactly.
age. And we need to recognize that and make it more safe for them to do that.
We do, and so part of that is setting up the construct in the family and in the community, right, so that if those things are going on, we have an idea of what's going on, we can help to intervene early on, we can mold it, shape it, all of those kinds of things, right?
Are there any best practice programs that you've seen or?
Well, there are lots of things, and I think that that's one of the things is that when we look at the issue of addiction, no one wants their kid to become addicted, right?
No, certainly
so it's not something that any of us would wish on ourselves, our kids, the people that we love, right? So when we want to take this approach around preventing addiction, we can go to kind of a programmatic level, which may be something like having the nurse-family partnership, where you have trained nurses who can go into homes of first-time moms and just help them out with their parenting skills and understanding child development. That is one of the best prevention programs that we have, not just for substance abuse, but also for teenage pregnancy, for getting kids to stay in school later in life. So, and that's an intervention that happens at the infancy, right? When this
From
child is an
infant
infant.
across the
Right.
well child
Right.
experience. Yeah.
So that is an example of a program. Now, if you want to move more into like a practice, it may be something like physicians actually taking the time to do an assessment around adverse childhood experiences with the parents that are coming in with their children into their pediatric offices, because if the parents have experienced these ACEs that we
Right.
call them, then there's a very good chance that they're passing them on intergenerationally to their children. And unfortunately, quite often that means that there's an elevated expectation that we see around whether those kids are going to wind up becoming drug addicted. And so you can actually go through a screening process with the parents to find out were they abused as kids,
and give them the information they need to make a choice and to help them break
Well,
some
it's
of
to
those
get
cycles.
exactly it's
Yeah.
to get them into services essentially, right? So that they can begin their own their own healing. They begin to peel back kind of the layers of their own trauma, so that they don't re-traumatize their own kids. So that's an area around practice, and then you can move even further upstream and really look at policy, and that's some of the things that we're talking about. Like, do people actually have the wherewithal to make a living wage?
Correct.
Right,
Yes.
so that they're not working 2 and 3 jobs and not around to support
to
their
be
children.
parentals.
Do we have subsidized or even free childcare and preschool? Right? I mean, that would also go a very long
And
way.
we know that preschool, getting people into early childhood
Yes.
education, is one of the best return on investments
That's
that
exactly
we have
right.
for our public health dollars.
That's exactly right. So it's setting up these kids for success for later on down the road. And of course, it's looking at policies around incarceration.
Yes.
I mean,
Tell us a little bit more about that.
well, I mean, there's so much discrimination and bias in the judicial system at so many different levels. And so we just see that played out with our prisons being full of, men and women from our community. And so that has to change. That's an area where we really need to have some intervention at a policy level.
Definitely. If there was one message that you wanted viewers to get from this conversation,
Yes.
things that they can do or think about differently, what would that be?
One thing that they could do or think about differently. Well, I really want to make sure that people understand the compassion and the human element around addiction and around this really being a health issue, right? Because so often, as I said before, it really is about blaming someone, about shaming someone, about wanting to punish someone for that addiction. And that's the one takeaway that I would want people to think about and to consider is how can we shift our resources, how can we shift our policies so that anyone in our society who finds themselves moving down that road towards addiction is able to get the help that they need, and they're not shamed and blamed for it, that they're not charged for it if they can't afford it, and that's the way that we go, as opposed to having any kind of punishment for people. That's not the direction to go.
Right. That many times these are people in pain or that have suffered
Absolutely.
other experiences
Absolutely.
that have led them down this
Right,
road.
and so they may
we
be
can change that.
self-medicating, they may be trying to take care of the traumas, in their lives, right, and so this is a way that we can heal that cycle for them.
Thank you so much. We're so glad to have you, and I'm excited to hear more from you on our panel tonight.
Thank you so very much.
Well, good evening, Dr. Olivia Cassier.
Good evening.
Good evening. We are here at the Black Physicians Forum in 2018, and tonight we are talking about modern-day drug addiction in relation to health and poverty in the African American community. And I'm so glad to have you here as our public health officer, Sacramento County, to talk about the work that's being done here, the opioid crisis, and how we can have a better public health approach to this. So tell us a little bit about, in Sacramento, what does the opioid crisis look like?
So first of all, I just want to say I'm really happy that I'm able to come to this forum and share some of the experiences that we have. And thank you for the invitation. My job as public health officer, because oftentimes people don't understand what that entails, is to look and look at conditions that are occurring in the community, to look at the health of the community as a whole. And we do that a lot by looking at data which comes to us through either death reports or from reports from hospitals about conditions that are going on. And based on that, then we look at priorities that we need to focus on and work with the community to address those problems.
So this is not just individual behaviors. This is how we look at Sacramento County as a population and how we're doing.
And that's the role of the public health office. It is different from clinical practice, because clinical practice, you look at the individual who comes into the clinic.
Right.
But public health, we look at the entire community, and our focus also is not just on those who are affected by the disease condition, but also look at ways of preventing and reducing the disease burden in the community.
Right. So tell us about some of the work that is going on around the current opioid crisis.
So the opioid crisis, this has become an issue of more in recent years, especially on the West Coast. We'd heard about it in the Midwest, and it has been creeping to the West Coast. And our real introduction to it in Sacramento came a couple of years ago. We got a call from a poison control center, and they said they were noticing something unusual. They were getting a lot of people being reported with overdoses, and these were people who were requiring multiple doses of the antidote, and so they felt that something was going on. So of course we have our contacts with the hospitals. We called them up and asked them to report to us any additional cases of overdoses, and we worked with law enforcement as well. And over time we found out that there were pills that were being sold on the street that were being sold as narco pills, but they were actually fentanyl pills. And fentanyl is 100 times stronger, so of course these were people who were taking 1 or 2 pills, and they were getting overdosed because they were getting a lot more than what they thought they were going to get.
So part of the problem was they actually didn't know what they were taking, because what they thought they were taking was one drug, but it's actually another drug that was there.
Right.
And that's part of the challenge as
That
well.
was part of the challenge. So of course we realized that, there might be a lot of people out in the community who are at risk. So we worked with the media and got the message out, and over time the number of reports of overdoses reduced. But it was a wake-up call for us, because up until now, then we were hearing reports, but they were more anecdotal, of people's experience with overdose, and it was mainly with teenagers who were either experimenting or somehow had gotten into the habit and then got onto using other drugs. And so this was a wake-up call for us, because we interviewed the people who had gotten the overdoses, and a couple of things that came to light. There are a lot of people who were buying these pills off the street or getting them from relatives or neighbors, and they didn't realize what they were getting.
Wow.
But also the fact that a lot of people were taking pills that were not prescribed to them.
Yeah.
So we realized that this was something we needed to address.
And what have been some of the responses?
We put out a call to get stakeholders together, and we got a very strong response. We actually ended up forming a coalition, and stakeholders including people, clinicians, people from hospitals, people from law enforcement, people who are community-based agencies that work with drug use and abuse, and so a very strong coalition. And over time we've been looking at strategies of being able to address this problem. And of course there's not just one strategy. This is a complex problem, and so some of the things that we need to look at are, first of all, education, because as we found, a lot of people get into this thinking they can handle it. It's just maybe taking care of a little pain here and there, and they don't realize how addictive these drugs are. So education is a very strong component of what we need to do. and also education to people who actually get those pills prescribed. Because one of the things we found is that a lot of the, especially the youth, would get into this by going into parents' or relatives' medicine cabinets and start taking 1 or 2 pills.
So things that family members may have, if they have medications that they've taken, but maybe they didn't take all of it and they've left it in their medicine cabinets or in drawers in the kitchen. These are the drugs that people are getting access to. These 2 youth are getting access to.
Especially the youth. So really important for people to realize that when they have these kinds of medications, to lock them up. And if they don't need the medication anymore, to dispose of it appropriately. So the other part of that is actually being able to work on ways of providing access for people to dispose of these, because we don't want them to just throw them in the garbage.
So there's special ways or places they need to go to dispose of these?
Right. And so that's one of the things we're working on, because there are a lot of rules around how to dispose of medication. You can't just take it to a pharmacy and say, here, take my medication.
Oh, okay.
So being able to work on that. So that's another strategy. The other, of course, is also working with healthcare providers. One, to be able to recognize when someone is addicted so that they can provide them the help. Because one of the things we've heard is sometimes people are afraid to come forward because they think that they'll be shunned by the society. They will be, they will lose access to their healthcare provider, and so we have to work with the entire community to learn how to deal with this in what we call a trauma-informed approach, where you realize that the person has a problem, but instead of making them feel bad about it or condemning them for it, realizing that this is an illness. When someone comes to you and says they have diabetes, you're not going to say, well, your blood sugar is high, I don't want to see you anymore. No.
Right.
You talk to them and say, hey, let's talk about what's going on. What are you doing that we need to change in order to change your blood sugar? So the same thing when it comes to addiction is realizing that this is an illness and that people don't have control. And so helping them to get back that control.
So providers can play a key role in really talking to their patients that are on these medications about what they're taking and how it's affecting them, and then working with them. And patients can expect from their providers to understand that this is part of the process of them getting the help that they need, not just for that one issue that they prescribe that for, but other issues that they have as well.
Right. And also the other thing with providers is also unlearning some of the prescription habits that we have developed over time. Because now, for example, if you get your tooth pulled, you'll get a whole bottle of pain pills. And is that really necessary? No. You probably need pain pills just for the first couple of days. But if you're being prescribed a whole bottle for 30 days, then what happens to the rest of those pills? So working with the medical community to see how we can reduce the number of people who get prescribed those pills, make sure that it's appropriate and is for the shortest time possible, so that people don't end up getting addicted.
If there was one thing that you'd like viewers to know or to think about differently as they think about our changing drug policies and addiction, that it may be impacting their family, what would that be?
I think for me the main thing I have learned through dealing with the different people and dealing with this issue is realizing how much people who are addicted are not in control of that addiction, and realizing it's an illness. And I think when we realize that as a community, we gain compassion, and we don't have this attitude of how could you do that to yourself, or you just need to stop. And then also realizing that we need to provide a treatment so that people who are addicted can actually get help. So I think those are things, they're not easy, but I think those are things that would really help in helping us to get through this.
Yeah, well, we are so excited that you're here, and I look forward to hearing more of your panel presentation. It's so encouraging and assuring to know that you're working from this from a population perspective, that it's not just individuals' behavior, but that there's data out there to support what we need and how we change the systems and how we work with both providers and families and individuals to really make this an issue and a community that we can all love and trust. So,
Thank you.
Thank you so much, Dr. Kassir. So I'm excited to be here with you at the Black Physicians Forum 2018, where we're talking about modern day drug addiction in relation to health and poverty in the African American community. Welcome, Dr. H. Wesley Clark.
Thank you.
Thank you. We are so excited to hear from you about some of the cultural implications that happen with substance use and some of the cultural factors that influence that. Would you talk to us about that tonight?
Sure. One of the issues we have to take into consideration is that there are variations on the theme of substance use. Mm-hmm. Right now, we're in the midst of an opioid epidemic, and that epidemic is affecting the largest society, including African Americans. But in addition to opioids, there are other substances that are affecting the lives of African Americans, not just opioids, but cocaine, marijuana, alcohol. And if we minimize that full spectrum of substances and focus only on one substance, then from a public health perspective, we're actually guinea pigs in a treadmill or wheel.
Can you kind of tell us some of the different medical considerations there are and how that fits in with some of the public health considerations? How are those things working together?
A public health strategy looks at the community, the particular community's need, and what's going on in the community with the people in the community. It takes into consideration the different stakeholders, people's socioeconomic status, people's cultural orientation. For instance, with the CDC guidelines, there's an increased emphasis on using non-steroidal medications like ibuprofen or acetaminophen for analgesia. Well, the paradox is historically African Americans had less access to opioids in the first place. That had begun to change. But one of the complications is drugs like ibuprofen for chronic pain can have damaging problems to your kidneys. So we have a problem with hypertension in the African American community, and what we don't need is to have that exacerbated by the injudicious use of ibuprofen. Drugs like acetaminophen can be toxic to your liver. So we don't want people treating their pain with excessive uses of acetaminophen. So we got to have access to good health care that allows for different strategies to be used, not just medications, things like exercise, acupuncture, chiropractic manipulations, other things, so that we can deal with the pain that people experience. Otherwise, we attribute everything to substance abuse, when in fact what we're undertreating is the pain that people are experiencing.
So people need kind of that full spectrum, that it's not just one issue, but they need the medical partners to work with, as well as some of the larger public health societal issues. The larger
issue is the management of pain. The fact of the matter is, even those people who misuse their pain medications, over 60%, contend that what they're trying to do is treat their pain. So, and then the cultural dynamic is depending upon with whom you present. Data show that non-African American practitioners often minimize the pain that African Americans are experiencing. So they undertreat it.
So they're not actually getting the right level of care.
They're not
in
getting
addition
the right
to maybe not getting the care all of the care that they need to help them fix their problem or achieve their health
Right.
goals.
So the public health strategy requires us to monitor what's going on, to do a careful consideration of the various factors that contribute to someone's health care, and to devise strategies that take those things into consideration.
Can you tell us about some of the work that you've been doing and what you've been working on lately?
Well, what I've been focusing on is making sure that people have an awareness of what's going on in their health care, and that those people who present for substance use treatment are consulted about what happens to the information that
How that information is shared outside of...
That is developing into a major theme. There are those who would like to have access to your healthcare information. They would like to have access to the fact that you have a substance use
And
problem.
that can be used both positively and negatively.
That can be used positively and negatively.
yeah.
And want to empower people to play a critical role in their own health care and to determine who gets access to the information that they may consider sensitive. There are those who say, well, you don't need to have that kind of control over your personal information. But the fact of the matter is that information can be used against you. There are information brokers who want to share that information to parties outside of your awareness. And those parties can make decisions about your well-being without you even knowing it.
And I think sometimes patients feel like that they're not sure that they can actually ask questions or push back on things like that with their providers. But what I think I'm hearing you say is that that's definitely well within their rights.
Not only is it within their rights, it's very important because what's happening is that 90% of the people who meet criteria for substance use disorders perceive no need for treatment. So they're not engaged in treatment, and one of the things you don't want to do is scare people away from treatment.
Treatment, correct.
So if you meet criteria for having an alcohol or a drug problem, you want to feel that the people to whom you're presenting are taking your best interests at heart.
Right. What is one thing that you'd like viewers to know and to think differently about, or to help take us to on a more positive track with this issue of understanding substance use and how it affects health and poverty in the African American community?
Well, we want the community to understand that this is an issue. It is a problem, and that particularly for our young people, 18 to 25, that it influences your decision. It can cause you to do some stupid things, and it interferes with your ability to cope in society. There's a recent episode of a young woman, 20 years old, blowing smoke in a 1-year-old baby's face, and then putting that on the internet and Facebook. And of course, she winds up being arrested for being not only stupid, but using marijuana and exposing her 1-year-old child to a dangerous substance. And it did not register with her that this was inappropriate. And what we want to do is to make sure that people are talking about these things, because there's a tendency in some communities to keep these kinds of things secret. There's a stigma associated with substance use.
We don't want to talk about it.
We don't want to talk about this as an issue, and as a result, from a public health point of view, this information is, from a prevention point of view, this information is not shared. People
Right.
minimize the consequences, and we need to understand that some people are vulnerable to these drugs of misuse, and as a result, they engage in behaviors that are woefully unsuitable. So this girl's pictures posted all over the internet. The baby's pictures posted all over the internet, and there's no rational justification for blowing marijuana smoke in a 1-year-old's baby.
But what she thought might have been harmless if someone else had kind of talked to her, told her about that, and explained at least to her before it became a criminal issue.
Exactly.
Where she's losing her child, that would be a more holistic environment for us to be operating in.
She needs to And that's what we want the community to do, is to embrace appropriate behavior, healthy behavior, and to encourage people who, while under the influence, are dysfunctional, to recognize that the consequences of misuse can be profound and prolonged.
Right, right. Thank you so much for coming tonight and sharing this information for us, and I really look forward to hearing more of what you have to say on our panel tonight.
Thank you.
Thank
The
you.
pleasure's mine.